Hey team, welcome back. We're going to talk tonight about ultrasound guided chest tube placement and thoracentesis. This is part of the overall larger series of ultrasound guided procedures, which we use oftentimes in the emergency department, and by oftentimes I mean daily. So, why do we use ultrasound? Back in the day when I was training and dinosaurs roamed the earth, we didn't necessarily use ultrasound for every single procedure. But we've started to realize the value that ultrasound adds to just about any procedure that you do in the hospital or in the outpatient setting. So, using ultrasound, we can actually visualize the procedure in real time. We can decrease the number of attempts, we can decrease the complications, which leads to improved patient safety overall, which that's a huge benefit. So what procedures are we going to talk about? Well, today, thoracentesis and chest tube placement. But right now, we'll start with a case. We have a 62-year-old male who presents to the emergency department or maybe to his outpatient internal medicine clinic, family medicine clinic with worsening dyspnea over the past month. It's gotten so bad that he can now barely walk into his kitchen without becoming more short of breath. And he's like, Doc, man, I stopped halfway to the kitchen just to rest. I don't have any chest pain, but I can't breathe anymore. No medical history. His vital signs are given, and you notice that he's actually working pretty hard. He's tachypnic, just sitting there in your office, and he's hypoxic, 90% on room air. You do your physical exam, and your physical exam reveals decreased breath sounds over the right thorax. So remember our thoracic lecture just a few weeks ago. So you know how to do lung ultrasound. Huge benefit is you have a chest x-ray which shows complete whiteout of his right lung. You didn't necessarily need that if you had your handy ultrasound present, because you do an ultrasound and you look at, over his right thorax, we're seeing a large pleural effusion. So we see the spine sign at the bottom of the screen, we see the fluid which is anechoic, and we see a little lung sliver that looks almost like a sail just floating in all of that fluid. So we need to know what that is. So we're going to do an ultrasound guided thoracentesis or potentially place an ultrasound guided chest tube, which we would for pleural effusion or for a pneumothorax. So we need a thoracentesis kit, which is very similar to a paracentesis kit. This is a sterile procedure, so we're going to use betadine, sterile gloves, a sterile drape, and a sterile ultrasound cover. Now, so for our ultrasound guided thoracentesis, I like to have the patient sitting upright. So fluid will sink to the bottom, and have them sitting upright. Give them a tray or something to rest their arms on. We want to identify and mark the area with ultrasound. We want to make sure that we're identifying the diaphragm, the lung, the spleen, and the liver, because these are some pretty big structures that we want to make sure we avoid. And I'm just going to go over the kit with you right quick. So you have your needles, your lidocaine, then you have your big needle in which you do the thoracentesis, your guide wire, your dilator. Then you're going to put that long tube into the actual pigtail catheter and place that using Seldinger technique. Then afterwards, you take out that long gray tube, and then you can connect this to your pleurovac, if you will, and you can suture it in. I think we went through that really quickly, but if we go through, so I'm grabbing my syringes, filling them with lidocaine, and doing a skin wheel and numbing the skin, and I actually numb down to the bone. So I numb the periosteum. Then I use one of my larger needles, and then I actually go in with the lidocaine again, make sure I'm numbing, and I march my needle over the rib so as to avoid the vein artery nerve complex that runs underneath the rib. And then I go in, and as I'm going over the rib into the pleural cavity, I'm withdrawing. And if I have a pneumothorax, I can see air bubbling through my lidocaine. If I have a pleural effusion, I can see the fluid coming into my syringe. Then I use Seldinger technique, which means I'm placing a wire through that needle into the pleural cavity, and then over the wire I am dilating and then I am placing my tube after I remove the dilator. Then I'm placing my chest tube, my pigtail catheter into the pleural cavity. And then I'm hooking it up to, this is a Pleurovac, so it's a standard water seal device which allows drainage of a pneumothorax or pleural fluid. So using ultrasound, I first want to identify and mark the spot. I can use ultrasound for real-time guidance, and I'm going to numb the area down to the rib with a lidocaine, and I make sure that I numb that rib. I march my thoracentesis needle over the rib. Underneath the rib, we have the vein, artery, nerve complex, which we want to avoid. So I'm never going underneath the rib. I'm going directly over a rib. And you can just see a little schematic here. So marching over the rib and then using that needle to go into the pleural space. So here we have a little video right here. So we are numbing, and I'm actually using ultrasound to guide this in real time. I have a sterile probe cover. We have sterile gloves. We have sterile gowns. The patient is sitting upright, and we are using ultrasound to guide that needle into the pleural cavity over the rib. So now once you have that fluid or that air, then I am taking the syringe off. I'm putting my guide wire through that needle. I'm taking that needle out. I'm using my dilator to go in and kind of make a nice larger tract. Might have to use a scalpel to do a little skin nick. So once my dilator's in, then I take my dilator out, and then I insert my pigtail catheter over the guide wire. If I used that gray straight long tube that goes inside the pigtail catheter in order to straighten it out, after I do that, then I take that gray tube out. So I have my pigtail catheter in the chest cavity. Then I'm suturing it in and hooking it up to my Pleurovac. And that is how you either do ultrasound guided chest tube placement or thoracentesis. So as always, email me with any questions. Thank you.